Post-transplant cyclophosphamide has been a major development in transplantation over the last 2 decades. First developed by our colleagues at Johns Hopkins, it was first publicized in the use of haploidentical transplantation, and it has actually made haploidentical transplantation safe and really almost the standard of care for a variety of transplant indications. The ability to engender engraftment and successfully prevent acute and chronic graft-versus-host disease is remarkable. And so it was only natural after seeing the success in haploidentical transplantation that we all thought about studying post-transplantation in the more conventional donor space, that being either match-related or matched-unrelated donors. At our center, we generally have used post-transplant cyclophosphamide-based graft-versus-host disease prevention for our haploidentical transplants, certainly. And we have now used it as our standard for patients who are receiving mismatched, unrelated transplants as well. Recent results have suggested that we should now consider post-transplant cyclophosphamide in the use for our standard patients as well. These results include the now published trial of BMT-CTN-1203. This was a reduced intensity trial. This was a trial in reduced intensity transplants that compared 3 different graft-versus-host disease prevention regimens to a registry control of our standard of tacrolimus with methotrexate. The results of this trial suggested that post-transplant cyclophosphamide-based GVHD prevention was superior in that comparison. And now the BMT-CTN is moving on to a formal phase 3 prospective trial comparing our standard of tacrolimus methotrexate versus post-transplant Cytoxan in the reduced intensity platform. At this ASH, one of the abstracts in the plenary session was a HOVON study that did a similar study in reduced intensity transplants comparing post-transplant cyclophosphamide-based graft-versus-host disease prevention to a standard of cyclosporin with mycophenolate mofetil. The results of the trial will be presented Sunday afternoon, showing that patients who received post-transplant cyclophosphamide-based graft-versus-host disease prevention had clear benefits in reductions in severe acute graft-versus-host disease, moderate to severe chronic graft-versus-host disease, and the composite endpoint of graft-versus-host disease relapse-free survival. Those results are compelling. We await results of this phase 3 study by the BMT-CTN. Our group at Mass General also presented an abstract here at this ASH showing the results of 9 patients with non-malignant hematological disease such as aplastic anemia, diamond black fan, as well as pure red cell aplasia, who underwent allogeneic transplantation using a post-transplant cyclophosphamide-based platform. We had read the results published by our colleagues at Johns Hopkins showing such success in haploidentical transplants, conventional donor transplants, and their results using this platform for non-malignant hematological disease. So several years ago, we had adopted this, which appeared to be our most potent way of preventing graft-versus-host disease for this specific population of patients who have zero benefit from graft-versus-host disease. Our results presented here on our 9 patients treated over the last 5 years are very compelling, showing all patients with full donor hematopoiesis, very little graft-versus-host disease in all patients surviving. Those past 12 months were all off of systemic immunosuppression, and now this has become our standard for this population of patients.